some of Sharani's friends in Brunei hope that they'll be okay.
Yesterday, I was discharged from a 17-day hospital stay in North Bay,
Sharani says saving face is important in Brunei,
where the same blood-spotted sheets were on the bed the same as the day I was admitted to hospital.
We're live here in the National, and we're following some news that's just come in from New Zealand.
No sheets were changed in over 2 weeks. No bed was ever made, not even once during that 2-week period.
So he'll be back in court Friday, New Zealand time. That's less than 24 hours.
Today, an old friend of the family called me from down south, which is Toronto area, to say they're thinking of moving to North Bay. Well, after our discussion on the phone about health care in North Bay, they changed their minds about moving to North Bay. So you see, social media is an important tool thanks to Facebook, LinkedIn, YouTube, Twitter, and all the other many social groups and networks. So, talk to persons who moved out of North Bay before you consider moving in. The hospital is rated at a low level C, which I would rate even lower.
And as doctors across the country call for stricter gun control immediately.
Dr. Shaw stopped my Eliquis medication, which is processed through my failing kidney, which caused internal hemorrhaging because my liver could not process it. I'm very much indebted to Dr. Shaw. Thanks so much. The condition of my heart and kidney called for a blood thinner which does not get processed through the liver, through the kidney. So Dr. Shaw changed my medication to Coumadin, which, as many are aware, is warfarin, or it's a rat poison. Well, it stopped the hemorrhaging. It brought my INR up from 1.0 to 2.5, which prevented further kidney failure. As an advocate for senior citizens, I feel many are victims of abuse, neglect, or perhaps forget by those who get paid to be responsible for senior citizens' care. Is this not sort of planned neglect? I can speak from experience as a victim, which helps me to understand and fight against such punitive treatment as, number one, a male nurse discharging a palliative care patient without even consulting the doctor on duty. Number two, a physical assault causing bodily harm by an aggressive female nurse at that hospital, leaving the patient with a badly bruised neck, which was seen by the doctor, by nurses, by patients, and even the police who were called. After which, suddenly the umbrella of silence appeared and everyone is expected then to shut up, cover up, or sweep it up under the rug. My requests for x-rays were refused, but pain medications and hot compresses were provided, but everything was covered up by the silence at the hospital in North Bay, Ontario. Both nurses are still employed. Is it mum's the word? Is it because no rug is big enough to cover up everything that goes on in this horrible health system in North Bay? Although they contribute to try by practicing and demanding silence throughout the whole horrific system. However, cover-up rugs do not work on social media such as YouTube, Twitter, Facebook, etc. So if you care, please share this video. Thank God for that, because it allows seniors to use the only tool available to them and to me, which is to shame abusers who deny decent, adequate, non-abusive senior care, which we have been paying for, meaning we seniors, we have been paying for through OHIP since the innovation of the health plan in 1964. PSWs get paid about $16 an hour, which is about $31,000 for the year, except one PSW who works at the North Bay Hospital, a man who gets paid $104,448 salary. Wow. And of course the hospital president, he gets paid the beautiful sum of $362,177 a year. Ontario Premier Ford fired the sunshine earners at the 14 Lynn outlets. Only the restoration of light housekeeping, which was refused by Lynn, will satisfy seniors who keep repeating the same complaint. I just wish that God would take me. Is that not the result of perhaps a tacit practice of illegal euthanasia? We're all familiar with the legal use of euthanasia, but is the result of a possible illegal use of euthanasia any different? Whether it's legal or illegal, it still leads to the same result: death. D-E-A-T-H. Look, I will always be an advocate for seniors and PSWs because both groups are mismanaged. They receive shabby treatment with little or no respect or appreciation. My email is captainalyetman@yahoo.com or yetmaninfo@gmail.com. Look, we're all going to become seniors, and if you think this system is going to change, it is not going to change unless people speak up. I don't hide from what I'm saying. I stand behind what I say. I leave my name, I leave my email address. All I'm asking listeners to do is to view this video and then share it with others. Something must be done. We all have grandmas, we all have grandpas, we all have children, and They need our protection, especially children and seniors. That's another story when it comes to children. Thank you for viewing this video, and I hope you do share it.